I personally work in our division that's focused on the rights of people with disabilities. And I have been coming to Nigeria now for more than a year. And I have been to 7 different states to investigate what's happening in traditional healing places or Islamic schools or rehabilitation centers for people with mental health conditions. So we are talking about people who have, for example, depression, anxiety, schizophrenia, so a medical condition. And what we have seen in many states, including here in Kaduna, is that people with mental health conditions, due to a strong belief that there is a strong belief that they are possessed by a demon, and so they're taken to these traditional healing places where they are put in chains, so their feet are chained. And I actually just wanted to tell you a story of a man that I met 2 days ago when I was in Kano. So I went to one of the Islamic rehabilitation centers where they keep in the same place people who have been, who are drug addicts, people with criminal behavior, people with mental health conditions, and children. And there I met one young man, Suraj, who experienced a mental health break in November last year. And he went to a psychiatric hospital where he got medication and he got better. And then he went back to his village. But one day 2 men came and they arrested him. They put chains on his feet and on his hands and took him to this rehabilitation center. There I met him shackled to another man who is there for drug addiction. And he was literally, so his right feet were connected to another man's left leg. And I asked them, are you being held like this all the time? He said yes. I was like, even when you have to go to the toilet, yes.
He speaks English too?
No, I had an interpreter.
Okay.
Even when you have to defecate, yes. And what our fear is, and I'm Muslim too, and of course as a Muslim I believe in jinns and I believe in possessions. However, we know that what we should do when it comes to jinn possession is to pray, to read Ruqyah, correct? And to help people by reading Quran. It's not by flogging them, it's not by chaining them, but also we also know as Muslims that we should believe in science and in medicine, and that for people who have mental health conditions, they should be provided with adequate treatment. These people have no right to decide to be there or not to be there. So our relative, we have met children. For example, I met one 8-year-old boy and 10-year-old boy who were held with 29 adult men, a third of this size. And you know what their story is, what the Malam told me? So the Malam told me how their father remarried, he got another wife, he sent the first wife away, and he just came and dumped his children there. So he's paying the Malam to keep his children in shackles in a room with 29 adult men, some who have behaved criminally, some who are drug addicts, putting the children at risk of sexual and physical abuse. And what I'm not doing is, I'm talking to many religious leaders in Nigeria. I'm talking to the government. I spoke with Hizbah in Kano. I really do believe that we all have to come together to stop these abuses, because I firmly believe, after visiting more than 20 places across the country, that these places are doing more harm than good. However, I also have to say that there are Malams who want to do well. You know, there are Malams who are good people, who really want to help these people. So not everyone is abusive and not everyone is doing things that are not correct, but unfortunately majority are. So in that way, I was hoping that we could have this meeting so to hear your opinion, whether you have heard about this. Are you aware, for example, of the existence of Malam Nigam place, Rigasa? What is your opinion? how could we work together to make sure that the message goes up. It's not Islamically to treat people who have depression, anxiety, schizophrenia by shackling them, by flogging them, by beating them, but by compassion, by counseling, by how they are supposed to be treated that can help them. So maybe you could just first introduce yourself.
Okay.
So yes, I did Google.
Okay. My name is Ahmed Abu Bakr Mahmoud Gumi, resident of Kaduna State, in Kaduna town.
So can you tell us what's your profession? What do you do?
Okay, first, I'm self-employed, but as for my qualifications, I'm a qualified medical doctor, also an Islamic scholar, and I engage in preaching. I'm doing my private affairs.
Thank you so much. And so, in terms of just have you come across and what do you think? How should people who have mental health conditions be treated, both from your medical perspective, but also being an Islamic scholar?
Scholars. Okay. Allah has given me the opportunity to see the two sides of the coin, to see mental issues from the medical perspective, and also to study the Islamic literature, how it relates to mental health. I thank God for having that privilege. Actually, there is no discrepancy between modern knowledge and the Islamic scriptures. There is no discrepancy, but there is a misconception, especially from the Islamic perspective. The modern science or medicine is based, knowledge there is based on studies, statistics, experimentation, which Islamic knowledge has acknowledged as a source of knowledge. The Prophet ﷺ once decided to prohibit nursing mothers from getting pregnant. That is he wanted to prohibit it. Nursing mothers should not get pregnant, and he's trying to prohibit men from coming to their wives if they are nursing. Then he said he looked at the Romans and the Persians are doing it, and it doesn't injure the children. So you Muslims too can do it. This is a typical case of whereby scientific observation leads to a judgment in Islam. So wherever there is any Islamic law and scientific observations and experimentations proved positive or negative, they have the supreme authority. Islam is based on scientific observation. In the Quran, أَفَلَا يَنْظُرُونَ إِلَى الْإِبِلِ كَيْفَ خُلِقَتْ. Don't they see the camel, how it is created? This is calling to a scientific observation. وَإِلَى السَّمَاءِ كَيْفَ رُفِعَتْ. Calling to scientific observation. So scientific observation is part and parcel of Islamic jurisprudence, and it has precedence. It's the ultimate that decides. That's why the Prophet said, "Hamamtu an anhaakum an al-ghila." I have also intended to prohibit anhaakum, to prohibit for you coming to nursing mothers. But then I look at Romans and Persians, they do it, and it doesn't injure their children, so do it. So what prevented him from that is the scientific observation. So there's no question about that, except what I call it, people who don't know. Scientific observation has precedence over any law because it's observable, it's experimentable. Another one, the Prophet said, alayhi salatu wasalam, peace be upon him, Moses, when he went into the Mount Sinai to speak with God, God told him that his people have started worshiping the golden calf. He got angry, but when he came down and saw actually the Israelites worshipping the golden, when he saw it with his own eyes, he threw away the tablets of Torah. Here the Prophet said, look at, God spoke to him directly. So he doesn't have issue of authentication, is it true or not true? It's God who spoke to him directly. There's no question of is correct or not. But when he saw it with his own eyes, his anger was so much better than when he had it directly from God, and he threw the Torah. So here the Prophet said, what the eye sees is stronger than what the ear hears. Nobody can doubt this. So what we can experiment and see with our eyes is a stronger evidence than what we hear. So scientific observations, scientific conclusions are supreme in Islam. And that's why Muslim scientists are the ones who introduce even the dark ages of the West into science. So I'm so surprised why now Muslims are so skeptical about scientific observations. No, Quran says scientific observations is what we do. Look at it. وَفِي أَنفُسِكُمْ أَفَلَا تُبْصِرُونَ. This is a scientific observation. سنريهم آياتنا في الآفاق وفي أنفسهم حتى يتبين لهم أنه الحق. We show them signs. These are scientific facts and observations. So science is supreme over anything. The Quran is adilla sam'iyya, what you hear. The Hadith is adilla sam'iyya, what you hear. And there's another adilla mar'iyya, that is the what you experiment and see. That determines everything. Here he's so it's the science that confirms you that the Quran is true. Not the Quran confirms that science is true. No. So whatever we see, we test, we experiment, then we what we call it, interpret the Quran, tell you with the facts. Not construe, tell lies, change the fact to tally with what we think the Quran is saying. No, the Quran is always 100% with facts. And this is established. I have so many examples in the Quran. It goes with facts. If you see anything, you say mistake, whether it's frustrating, other information coming to temper with the true meaning of the Quran. There's no two way about it. It's not believing in the Quran. Coming to that then, now, Ibn Khaldun, for a long time, more than 700 years now, he said one thing. Even if he didn't say it, evidences have shown it. In his book Al-Muqaddimah, the preface to his long book of history, Al-Muqaddimah, Ibn Khaldun, the preface to his long, he has a book of history. The first book is the introduction. Preface, prelude to the book. He brought out some sociological, scientific facts he observed. He said the Prophet is a messenger of God, but the message does not contain knowledge of medicine, knowledge of engineering and other sciences. It is a message of law and worship. It does not contain. It's not sent to teach us how to build an aeroplane. He's not taught to teach us how to treat malaria. This is very important observation of a Muslim scholar during the dark ages of West. Why it is very important here is that the knowledge of medicine, the knowledge of engineering, mathematics, all falls into the experimentable knowledge which the Prophet didn't come to teach. Antum a'lamu bi amri dunyakum, you know better your world. It is what the Prophet said when he prevented people from artificial pollination. By this preface or this introduction, Islam has given us absolute power, authority to test when it comes to mental health. Yes, there are psychological problems, there are psychiatric problems, and what we call in medicine psychosomatic diseases, which can be treated psychologically. That psychological aspect of treatment, Islam has taken care of it. The Prophet said, whoever will read قُلْ أَعُوذُ بِرَبِّ الْفَلَقِ قُلْ أَعُوذُ بِرَبِّ النَّاسِ الْمُعَوِّذَتَيْنِ, the last two chapters, the last easiest chapters, every Muslim should memorize them. At the age of 2-3, whoever would recite them, they are sufficient for him against all evil forces. So we don't expect a Muslim to complain of anything evil affecting him. Just like I don't expect, if I go to White House, I don't expect to see a worker in White House malnourished. Is it possible? Why? Himself, or I don't think a worker will be there malnourished. Just the way you don't expect a worker in the White House or the Buckingham Palace or the Riyadh Palace of King Salman now to be malnourished. So the same way, the same level of belief, I don't expect any Muslim to come to me that he is disturbed by evil spirits. Because the cure is so simple. وَإِمَّا يَنزَغَنَّكَ مِنَ الشَّيْطَانِ, from the devil. That, as simple as that. This is what the Quran is saying. The Quran is the highest order. So nobody can come and tell me that here we are disturbed by demons and all this. They don't approach Muslim. If you see a Muslim behaving like he is demon possessed, he's not demon possessed, but the Muslim is having, now we are coming from psychological into psychiatric problems. He's having a psychiatric problem, whether he's schizophrenic, whether he has the mania, or different degrees of mania, depressions. He has such psychiatric problems, and he needs attention, he needs treatment. And this treatment should be based on scientific observations, not based on conjectures. This comes to your question. You gave me a story, and let me give you a more pathetic story. It happened in Niger, which is adjacent country, is there in the BBC. A father whose child was sick, having hallucinations. You know, high fever brings hallucinations. It could be typhoid, it could be malaria, it could be any other cause of fever. A small boy having hallucinations, high fever, he took him to Malam. The Malam immediately said he's possessed by the jinns. So what he did, he tied him by the thigh. He tied him by the thigh. So the father was there when they started beating the boy, that the the demon is so recalcitrant, he doesn't. The demon is the afraid, is the type that is so strong. The boy was shouting. The father could not stand the cry of the boy. So he left the Malam with the boy. He went home. This story is told by the father in BBC. So he said he there slept. As he was going, he could hear the cry of the boy from far. He went home, came back the next day. As he was approaching the Malam's place, there was silence, absolute silence. So he said, Alhamdulillah, the boy is cured. When he came, he found that the leg of the boy from the thigh, the rope where he was tied from the thigh downwards has blackened. So it became into an emergency situation whereby he has to go to hospital and he had to have amputation because there is necrosis, it's gangrene. He lost his 2 legs.
First of all, for reminding us of the importance of science in Islam and how Muslims should be treating other people, but also for telling that story, which we have heard in similar degrees or different degrees happening here as well. So just what's your opinion on chaining and shackling and flogging people who have experience of insomnia, depression, anxiety, schizophrenia? And can I also ask, can Mohammed take some photos while we are speaking?
Okay. Don't
Yeah.
worry. If you want to.
Well, they will send it to me, so he can just. What do you think of that whole idea of shackling and chaining and tying someone who has a mental health condition like depression, anxiety? Yes.
The modern psychiatric practice of dealing with all this kind of sickness is 100% Islamic because it's based on statistics, based on observation, it's result oriented. And how do you know that? There are clinical trials, blind trials to see that this method is working or not. That is the Islamic way. But to shackle somebody, to beat him, to do all those things, in fact, they are not even taking records and statistics and see which one is effective, which one is not effective. Because it's not the Quran that is saying that. It's not the Hadith that is saying that. It's just their own conjecture. So absolutely, it's a crude, barbaric, unscientific, uncivil, and it shows Islam is a religion of mercy. It's very, what do you call it? It's very unbecoming. It should be stopped. There should be law to stop it immediately. Immediately. We cannot hide behind ignorance and behind Islam to be committing atrocities of all sorts. Women are raped, even in this case. Nothing, they have no boundary, just hiding behind demonic possession. The question of demonic possession, the Quran has debunked it. The Quran said, the devil, the Satan, the big one, even said, "Ma kana li alaykum min sultan." I don't have any power over human beings except to talk, to convince. So somebody has the power to accept or not to accept. Like in power, to commandeer you, to take you over. No. The demons have no power over that. That is a misconception based from Christian theology, because the Bible is full of Jesus casting out devils, yes. But when the Quran told us more about Jesus Christ without telling us that Jesus cast devils, it means the Quran does not sanction that part of casting out devils. Yes, Jesus was really curing diseases, leprosy, dumbness, yes. They're things that cost them. But people will come to learn, and the Quran is the last message, so it just kept blank about casting out devils. There's nothing about Jesus casting out devils in the Quran, despite the fact that the Quran told us so many things. وَيُكَلِّمُ النَّاسَ فِي الْمَهْدِ وَكَهْلًا, speaking to men, people, when he was in the cradle and when he's grown up. The Bible didn't say Jesus spoke when he's a baby. So the Quran is so specific about many things, but about the casting out devils. If there are devils that can commandeer human beings, that is the most important thing. That is the most important. That is the most dangerous threat to mankind. And if Quran is a book of guidance to mankind, then neglect a very important aspect of human threat, then there's something wrong with the revelation. No, there's nothing wrong with the revelation. What is wrong is the superstition people have. Demons, they don't have power over man. له معقبات من بين يديه ومن خلفه يحفظونه من أمر الله. When Allah created man, He put things that, angels that prevent him from min amrillah, from anything that can harm him. That's why the Chinese, who is not a Christian, a Jew, if you look at his lifestyle, he grows up protected by God too, as a test. They grow old. In Japan, you see people 90 years old. God did not give devil power over man. No. So, by insinuation. Now, those people complaining about devil, about sensation, hallucinations, and this is like psychiatric cases, they are sick. And the Prophet ﷺ said, Allah has not brought any disease except it has its cure. People know and people don't know, but it will become to discovered. Now things are becoming plain. People are discovering drugs for even AIDS that was thought to be incurable. Now there are drugs. Malaria as a vaccine. Now things will improve, as the Prophet ﷺ said. So what we say, let's return back to the Islamic basis. Psychiatric cases should be treated with dignity. They should be treated with a scientific mind, and see which method is good, which is not as mad. Coming to that, yes, there are some psychiatric cases, mania, whereby you use electric shock, yes, to reset the electrical waves in the brain. Yes, there are psychiatric cases that are chained on the bed, on the bed, if they are too, dangerous to be allowed. But what they do, they put them on the bed, chain them with their legs, and they give them medication until when they are subdued with chlorpromazine and other things. So this is modern medicine too, but it's done with dignity. It's done with respect for the human. It's not like the one we see now with these people, whereby they are cramped together, tied together like prisoners. Like, in fact, it has some negative psychological effect on them. Yes, what I will say now, if you look at the situation in the developing countries, especially poor developing countries, Nigeria is rich by its resources, but is very poor by its leaders. Very poor. We don't have leadership that are competent, leadership that knows what they are doing. This one comes and this one goes. Leadership, that is the problem. It's not the people, it's not the masses. I don't think in the world there is a mass of people who are so obedient, so patient than Nigerians. What they like is just the head. The body is good, but the head. So you see, somebody whose body is good and the head is bad, you call him psychiatric. This is what Nigeria is having. We have a psychiatric problem, the nation, So what's the cure? In this situation, these centers should be modified, not to be closed. Because now if you close them, the government has no facilities to observe. So in as much as they do some things that are anti-human, we should go in and stop those practices, improve them, and gradually the government should take the responsibility. And private doctors should be encouraged to open hospitals, psychiatric hospitals. And also, there is need to encourage doctors to study psychiatry.
Thank you so much. I would have so much more to talk with you about, but just because we are short on time, because we have to leave now, I would really appreciate an opportunity to have a similar conversation next time I'm here, and for us to really collaborate together on this, because you said so many important things. Like, as you said, there should be a law banning shackling. We also agree that we are not calling for an end to prayers or for an end to anyway, that's easy for you to share it with me, because it would be really great to use some of this for our video as well, if you have the permission.